Hi, everyone. Welcome to another one of our Facebook Lives here with Ogden Clinic. I am here with Dr. David Cope. He is at Cope Family Medicine, and he has COVID-19 updates for us today. Since we have been getting a lot of questions, there's been a lot of new updates. So he's kind of going to answer some of these questions that you may have. I'm going to let Dr. Cope introduce himself, and then we'll get started with the questions.
Hello, David Cope. I'm a family physician here in Bountiful and have been working with Ogden Clinic for 6 years now. Family physician, I completed a fellowship in vaccine science about 3 years ago and have a special interest in this.
Awesome. So if you've been following us for a while, you may know that Dr. Cope has been giving us a lot of COVID-19 updates throughout, the COVID-19 pandemic and how that's kind of been evolving. So he has a lot of questions regarding the new variant that we've been hearing, the Omicron variant, as well as vaccines for kids and the booster shot. So we're going to go ahead and get it started with the approval of the pediatric vaccine. So how did scientists and doctors determine that the vaccine is safe for children?
That's really an important question because I think it's easy to think that it was just presented and spread out and said everybody ought to get this vaccine, but there's an amazing amount of work that goes into determining that they're safe and effective. Fortunately, in children, some of the effectiveness data came from adults and it could be extrapolated, it could be extended down to young people. But because of pediatric age group, the younger age group have certain metabolic things that are unique to them and their developing bodies, that it entailed an entirely new study looking at those kind of safety factors. And so there was a cohort study of over 5,000 children who received the vaccine, and then those that received the placebo, looking both at its efficacy to make sure it was just as effective, and then obviously pertaining specifically to how safe it was. And it was really very encouraging. Down to age 5, that cohort of patients really had no significant side effects. And so of all the age groups that are getting the COVID vaccine now, it appears to be safest in young people. We know that from the theoretical concepts of the concerns about what would happen long term. And we know that now from the actual clinical real life data that it's safe. And it's been given millions of times now and continues to show incredible amount of safety. That was probably the biggest concern because we already knew it was going to be pretty effective. But
Right.
It's also in those same studies shown to be equally effective at both keeping a person from getting it, and if they do get it, if they do have a breakthrough case, at keeping the illness from being very severe.
Right. And there is still, regardless of, the study showing that it is effective for kids and it doesn't really cause a lot of, negative things like people would say. What types of questions do you regularly hear from parents who are still hesitant to get their children vaccinated?
I feel sorry. Not sorry. I feel sad, and it breaks my heart sometimes to see how afraid some parents are that they're going to do the wrong thing for their child, and they're caught in this world of getting the information from reputable sources or from real sources or from other sources, from friends and from Facebook and social media and media in general. And so all this noise out there of where the information is coming from, and they're trying to ferret through it and know what is right and to do the right thing for their children. Excuse me. And so they come in with legitimate questions. Often it's just that guttural feeling is, I just want to do the right thing. How can I know I'm doing the right thing? But then also questions about, is it safe? How do we know that it's safe? Is it effective? How do we know that it's effective? And will I have to keep getting booster shots over the years? Excuse me. And then really some of the same questions that we hear in adults. I hear this same concern about, will it cause infertility? If I give this to my 10-year-old daughter, will I worry about in the future, is it going to do something? And it's really nice to be able to answer those questions with the data now, because we have a lot of data. We know theoretically that when you get that little particle going, this fat particle going into the shot, and then it disperses within 15, 20 minutes, it's gone. But before it does, it just leaves a little message to the cells to make this spike protein that then the body reacts to. So it never gets into the nucleolus or the nucleus, and never gets into where our DNA is. It doesn't affect our DNA at all. It doesn't affect anything that could affect fertility. So it's nice to be able to assure those folks that it really is safe and not going to cause long-term effects.
Right. Yeah, I guess it's very similar to, the research that's been done for the adult vaccine. I'm sure it kind of has carried over to the pediatric vaccine as well, being able to
Very
prove
so.
that those things will in fact not happen if you vaccinate your children.
That's right.
So, is there anything else, I guess, in particular that you as a provider want parents and patients to know about this pediatric vaccine? Obviously, there's still quite a bit of man, I can't speak today.
Hesitancy.
Yeah. So what is something else that you would want them to know to kind of, I guess, encourage them to vaccinate their children?
I think we've all heard that it's primarily parents should encourage their children, or really should have their children get vaccinated, primarily for the benefit of their children. This really is a disease that affects children. It's not as doesn't as commonly affect children as it does adults, but it can. We've had over 100 children die of COVID in the United States. There's been nearly 10,000 children admitted to hospitals because of COVID. So the idea that this is just a disease of the old and the infirm is simply incorrect. It affects all age groups, affects them differently. And it really is important, number one, to get our children vaccinated for their own good. But also number two and number three is to vaccinate for the general good. By getting vaccinated, you help prevent the spread of the vaccine around the family, around loved ones, especially with Christmas coming, and we're gathering again in groups. Just today, I've heard several patients talk about how they went to a family gathering for Thanksgiving and they left with COVID, and they didn't know it till a few days later. But now the one lady I spoke to is very, very sick from it. And it's just heartbreaking to think that can be prevented. And so number two is to help prevent the spread to the family members. And then number three is just that global good for all of us. If we're going to really get on top of this pandemic, we have to all get vaccinated. That herd immunity that we heard a lot about early on may never completely make it go away, but it certainly will slow the spread.
Right, absolutely. And like you said, that's really important right now during the holidays as we're slowly starting to gather again and visit family members. So that's a really important point you mentioned. So let's kind of move in from the pediatric vaccine over to the booster shot. Obviously, that's another thing that we've kind of been seeing recently where the booster shot started off as only being available to, the people that were elderly or were a little more at high risk of getting COVID-19. But as we've seen, it's kind of expanded for everyone to get their booster shot. So who really needs it? If people that are on the fence of getting it or not, what would you say about the booster shot?
There are certainly, same with children, there are groups that are higher risk and need it more than others. But the bottom line is we could all get a booster shot. I think my patients will tell you I was a little skeptical at first of what the real purpose or what the value of it was, because when you get the first dose, you get quite a bit of protection. And the second dose gives you even more. And then it provides that long-term benefit. That's really why we get that primer and the booster. And so we early on didn't have the data to say how long that booster maintains those neutralizing antibodies that we need and what level they're going to stay at. But as time has gone on, we've come to see that the data really shows that the neutralizing antibodies fade down a little bit. And so by getting the booster, you boost that up some. But really now with the Omicron variant, it's become increasingly important because it is showing that with that booster and the B cell and T cell activation, that long-term activation that we really need, that's better with that third dose. And that'll help us prevent us from getting the Omicron variant even better than just the 2 doses will.
Right.
And so
And
right
that was actually my next question about, our people that have gotten the booster shot a lot more protected against the newer variants that we're seeing.
We live in a world where we're used to having immediate information and immediate knowledge. And so this has been frustrating for everybody to have to wait to see what develops. But
Hmm.
what is developing is the Omicron variant, again, a little premature, but it doesn't look like it makes us as sick or as deadly as the other variants have been, especially the Delta variant. But it does spread a lot faster. It spreads more easily. And so there is a real reason to get that booster to try and prevent the spread of the Omicron variant, because as that spreads, it'll continue to multiply and find even smarter variants, and we'll have even more trouble. So boosted people, we now know definitively that they are better protected against the Omicron variant than those who haven't received a booster, and for sure those who haven't had any vaccines.
Right. And speaking of the Omicron variant, I know we've been seeing it a lot. People see it in the news, social media, and we still don't know too much about it. But what do you want patients or the general public to know about this variant, and how is it different from, the variants that we've been hearing from in the past?
Each of the variant just means that there's a little different protein that's being manifest on the outside of this COVID virus, and depending on what amino acids there, which proteins being shown, that will change how the body responds to it. And there were just enough variations in the Omicron variation. There are enough mutations in those amino acids that it really gets seen differently than the previous variant. So we from the onset worried that it had bypassed some of our defenses, whether we'd been infected before or whether we'd been vaccinated before. And true enough, it's shown to do that. It sneaks by a little better, quite a bit better. And it also has a shorter transmission time. And so we used to talk about the 5 to 7 days after you've been exposed before you have it. Now it's probably more like 2 days or maybe 3 days from the time of exposure until you start to get symptoms. So even though it may not make us as sick, it still is pretty important that we clear it out or we get rid of it. And the only way
Right.
to do that really is through those vaccines and apparently a booster.
Right. And as for like symptoms when it comes to this new variant, are they very similar to what we have known from the past, or is there anything that kind of differentiates symptoms from, let's say, the Delta variant and the Omicron variant?
The symptoms are very, very similar. It seems like they really haven't changed a lot. There may be a little bit less of a cough and a little bit less of the chest pain, but the loss of taste and smell is that characteristic symptom is still there. Fortunately, only about 3% of the cases in the United States right now are the Omicron. Most of them are still Delta, and
Right.
so that may change as it goes through the community. We find out more, but right now symptoms seem to be pretty much the same.
Right. And let's go back a little and talk more about the booster shot. I know a lot of the information that we often get about the booster shot might not be, available for everyone, or not everyone knows, but there's this new thing that now that you can get the booster shot, you can kind of mix and match from what you've gotten previously. So, can you expand a little bit more on that and how that kind of works for people that might still be a little bit confused as to why you can mix and match those doses now?
Yeah, it's difficult because there's a science behind the vaccines and how that works, and there's those other things out there that cause the noise and cause the distractions. Um, and it's not necessarily a distraction, but one of those is the regulatory pathways that the vaccines go through, and whether it's FDA approved or emergency use authorized, and those kinds of things. We've known really for quite some time in the scientific community. The studies have shown there's now, I know of 6 different studies that look at those who have received different vaccine as boosters or different in the series. And the science has shown that they mount a very good response. There's just enough difference between those vaccines that by getting a booster from a different one that you got the primary series from, you sort of broaden that protection. You sort of open it up even more. We know that's particularly true with the Johnson and Johnson, that if you get a Pfizer or Moderna booster, that you'll get a better response. And that's probably true with Pfizer and Moderna, that if you switch those. The dose is a little bit different, but mixing and matching, as it's called, is probably a good thing.
So, would you encourage people to actually go ahead and mix and match these vaccines versus sticking to the same one, or does it offer the same amount of protection if you just get 3 Pfizer shots or 3 Moderna shots?
It's a little bit better if you mix and match. If you got a Johnson & Johnson, you encourage someone to go out of their way to look for a booster from one of the other two. If you got Moderna or Pfizer, I'd get a booster from whichever one's available, but preferably one from the other category.
Awesome. Yeah, that's a big question I think a lot of people have had when either thinking about getting their booster or going in to get their booster, knowing which one is ultimately a little better for them. So that's a good point.
It's sort of been off label and not talked about a lot in the science community until very recently when the studies have shown, but the FDA, even in their recommendations, left that open to get a booster, and they didn't say specifically to follow the same one. And now you can see their wisdom. We've known for a while, but didn't want to really double down on that. But now that we know the data is showing that it's better, it's good. Certainly doesn't mean, I mean, we're talking a few percentage points. So if you've gotten true Moderna and you're getting a booster in a Moderna, that's okay. Definitely okay. If there's a Pfizer there with it, maybe you want to get a Pfizer.
Absolutely. And would you encourage, obviously now everyone is available to get booster shots. Would you encourage people to get their booster shot regardless of, their category, if they're high risk or not high risk or
I would. The biggest reason not to is just concern about having enough vaccine for everybody. And we know that we have enough vaccine for everybody. So there's really no reason not to get it. Very safe. The chance of a reaction to it's very small. It's in that 15 to 20% range. And we certainly hear about those who get sick from it. But most people don't get sick from it. Most people do very well, maybe get a little achy and sore the next day, and then they're fine.
Absolutely. Is there anything else that you would like, our viewers today to know about COVID-19? Obviously, we're still seeing a lot of changes and updates, and it might cause some uneasiness in some people. So is there anything else you would like to add to our conversation today?
There's a lot I could say, but I just hope people get vaccinated. We've surpassed the number of people who died from the 1918 swine flu pandemic, and that gives me the chills to think about that. I grew up hearing about that and hearing how many people died from it, and going through medical school, hearing about that awful pandemic and what it did, and to think we've surpassed that with all of our technology and all that we do. And we can do better than that. We really can. This is a real disease, and most people have been affected by it, but not everybody has. And I just hope that our concern of the virus is much, much, much greater than the concern of the vaccine. No vaccine's 100%, so we're still going to have some breakthrough infections, and there are some issues with it, but they really are safe. And there's a tremendous amount of work and number of very smart people who are working on this and have good intentions and want to help bring this pandemic to an end. We should trust them and do our own research and talk to our own provider and come to our own conclusions. But hopefully in the end, we'll all get the vaccines.
Absolutely. That's an awesome message, especially with the holidays coming up. We want to make sure everyone's staying safe and protected, and we enjoy the holidays, because I know in the past 2 years we haven't really been able to do that to the full extent we can this year. So that was all great information. Dr. Cope, is there anything, would you like to leave a happy holiday message to our viewers before we sign off?
Very much. Happy holidays, and really enjoy it. It's a great time to spend with the family, whatever holiday we're celebrating, but happy holidays and stay safe.
All right. Well, thank you so much, Dr. Cope. Feel free to leave your questions in the comments. We're going to go ahead and sign off, but we will respond to your comments after this live has ended. But thanks again, Dr. Cope, for being here with us today, and we appreciate all your information.
Thank you.
Thank you.